now we have just discussed there are 2 types of Rasayana as well as 3 types of Rasayana. The 2 types is nothing other than the method of employment of Rasayana. One is done to an OPD patient, it is called as Vatatapika Rasayana, and the other is done to a very stringent inpatient, which is called as Kudi Pravesi Rasayana. And I have already told you the other 3 types, they are nothing other than Kamya Rasayana, Ajasriya Rasayana and Naimitiya Rasayana. But as far as the mode of action of Rasayana is concerned, we can again divide the whole Rasayana into 3 major subtypes. They are Rasayana which improve the quality of Rasa, Rasayana which improve the quality of Agni, and Rasayana which improve the quality of Srotas. You know these 3 words, they are Rasa, Agni and Srotas. I told you already, Rasa is nothing other than the tissue nutrition or the what is called the excellent nutritional element of food. Whatever you consume will be transformed into Rasa or nutritional element, and this Rasa will serve the purpose of nutrition to each and every body tissues. So, if you are able to ensure the Rasa is excellent, you will get a wonderful Rasa, so that the subsequent tissue elements like Rakta, Mamsa, Meda, Asti etc. also will get good nourishment. What is the second one? Agni. So, many Rasayanas are not directly giving quality Rasa, but it will try to improve the quality of Agni. Who is responsible for making wonderful Rasa? It is only Agni, because if the Agni is excellent, then and then only the consumed food will be properly digested and made into an excellent Rasa tissue. So, this Rasa, making of this Rasa is dependent on the quality of Agni. If the Agni is compromised, you know the disease is very common, because it is explained that all diseases are generated from nothing other than Manda Agni, lack of quality of Agni. Roga sarvebi mandagnu. So, if you can operate at the level of Agni, you can improve the quality of Rasa. So, you can operate at the level of Agni in the stomach, we call it as Jatara Agni, or you can operate at the level of Agni in different tissues, Rasa Agni, Mamsa Agni, Medo Agni, Asti Agni, etc. So, we have certain specific Rasayana which can operate at the level of Agni. Chitraga is a wonderful example, Bhalladaka is a wonderful example, where they directly act on Agni and improve the quality of Agni. For example, a patient suffering from hypothyroidism, if you want a cure forever, you are supposed to give Rasayana treatment for the patient. Bhalladaka is the best choice. Bhalladaka improve the Agni at the level of Jatara Agni as well as at the level of Medu Agni, so that it will correct the total tissue metabolism and will revert the process of hypothyroidism. What is the third? Probably you have a wonderful Agni as well as a good Rasa option, but it is not getting properly reached to the tissues or to the body because of some impurity in the Srodas, which is otherwise called as Kavaigunya, Srodovaigunya, in which Srodas are not perfect. So, you have to clarify the Srodas, you have to reduce the what is called impediment in the Srodas. The Srodas is getting clogged, and the clogged Srodas will not serve the purpose of proper Rasa reaching all over the body. You know the theory of Rasa. Rasa is moving from the GI tract, getting absorbed in the GI tract from the Koshta and getting circulated to the whole body through different Rasayanis and giving nourishment to each and every tissue. We have studied the concept of Kshiradithinyaya, Kedari Kulyanaya, Khale Kapotanyaya, etc., in which the Rasa is getting circulated to the whole tissue either by the theory of transformation, otherwise called as Kshiradithinyaya, or by the theory of selective absorption, otherwise called as Khale Kapotanyaya, or through the theory of channelization like Kedari Kulyanaya. So, If the channels are clogged, if the srodasas are blocked, no way the rasa cannot reach the site. So, even if you give an asthi specific rasayana, it may not reach the asthi if the srodas is blocked. So, you need a rasayana which can operate at the level of asthi vaha srodas to make the srodas open, clog free and devoid of any impediment. So, these three things are very important as far as rasayana is concerned. So, when you plan a rasayana to an individual, you have three approaches. Either you are directly nourishing the rasa like drugs like shatavari, or you may be increasing the agni, the drug like chitraga, or you may be opening all the channels like phalladaka. And many of them are having mutually helping mechanism also. For example, if you select Guduji, Guduji is always improving the channels of Raktavasrodhas. The same time it is a wonderful what is called Samshamaniya drug for Raktavaha Srotovikara. So, it will correct Raktavada Srodhas, the same time it will cure the Rakta disease by giving proper nourishment to Rasa. So, these are possible. So, these are the three important classifications of Rasayana. Now, you may have a doubt why this is happening, why this is happening in the present world. Is it whether we are getting aged earlier? Yes, we are getting aged earlier. Premature aging is a very important concern. You do not think that it is a concern of today. It was already described in Ayurveda thousands of years ago. If you go through the chapter Ayurveda Samuthaniyam Rasayana Padam in Charaka Samvida, Chikilsasthana, first chapter, where an exclusive discussion is explained, in which what was the importance of Rasayana, because it is explained in the text that the whole Rishi community, the sages community became of two types of lifestyles, otherwise called as Shalina and Yayavara. Shalina means few people started staying at a place and started cultivation, earning things, and became sampanna, became rich. They were not moving. Yayavara was Nityam Gamanashila, means they were moving from one abode to other. Those who are started staying a space, started a civilization, eating food and storing food, preparing food, everything was started. Then they started moving less, no exercise, they started disease. In that situation, Ayurveda identified that even rishis were getting disease. Then they all started discussing the problem together, they sat together and they identified a method what we can do. Then they told the present medicines are not going to work in us, we need some special medicines to improve us. Then they asked somebody to take the responsibility of arranging new type of medicines, and certain rishis are deployed for that. They went to Indra, who was having an abode at Devasthana or Devaloka, and they have given special type of medicines which were imported, and that medicine saved them. That means there are many hidden medicines in Ayurveda which can be utilized to prevent aging, to promote life when we are succumbed to many diseases because of our lifestyle. That is the message of the chapter of Ayurveda Samuthaniyam. So, this is very true nowadays also. We are unable to live as per the advice of Ayurveda. We are unable to follow the advices Ayurveda Upadesheshu Vidheya Paramadra. Even if we say Dinacharya, Rutucharya, etc., we are unable to follow it because of the fast lifestyle. Probably we cannot change all these things, otherwise we have to return to the total nature. It may not be always possible. So, we need a remedy for that. Rasayana is the remedy. So, in this approach, even if you are adapting a life of new lifestyle, still you have a choice to change your what is called degenerative issues or premature aging, etc., with Rasayana. So, I hope you have understood the concept of Rasayana. Now, I would like to say, I told you already, Rasayana is not geriatrics. It is not something to be practiced at the age of 70. Many people have misnomed Rasayana as something like a medicine for old age. So, consuming ashwagandha or consuming kapikaju at the age of 70 or 80 is not Rasayana. It is something a medicine is given. Rasayana means it should be practiced from the early age, something like Balya or Yauvana. So, that is called, already I have explained this sloka, Purve Vayasi Madhyeva Tat Prayojam Jidatmana. Jidatmana. Why Jidatmana? Jidatmana means the individual should be having such a willpower that I will do Rasayana with full consciousness. So, Rasayana is not an easy task. Probably you have heard the theories like Kayakalpa. Even legendary practitioners and great sages like P.S. Warrior tried Kayakalpa, but he was unable to complete it because of its severe difficulties. So, if you want to practice the qualitative or real what is called Kudi Pravashika Rasayana, you need a lot of willpower, and this willpower is established through many measures, and for that the individual should first undergo the complete purification like Panchakarma. So, Purve Vayasi Madhyeva Tat Prayojam Jidatmana Snigdhasya Shrutaraktasya Vishuddhasya Syaja Sarvada. The individual should undergo proper snehapana, internal and external oleation, then proper shodhana like Vamana, Virechana, Vasti, Nasya, etc., including Raktamochana, bloodletting. This should be done properly, then the body is purified. Not only this, if you want to undergo Rasayana or even Vajikarna, a special procedure of Shodhana is explained in text, which is called as Haritakyadi Yoga. Haritakim, Amalakim, Saindavam, Nagaram, Vaja, Haridra, Pippali, Velam, Gudam Chaushna Puna Pipet. We practice in our hospitals and clinics this particular yoga. After completing the whole 5 types of Shodhana, we give them a special drug of 9 medicines: Haridagim, Amalagim, Saindavam, Nagaram, Vaja, Haridra, Pippali, Velam, Gudam Cha, Ushnambuna Pipet. By hearing this sloka, you may feel that this is a very common yoga. How it is ensuring the complete Shodhana? We have given to many patients this yoga, and if it is given in sufficient dose, it gives wonderful Shodhana. Wonderful Shodhana as Upaya Shodhana. It induces wonderful vomiting and wonderful purgation. After a wonderful vomiting and purgation, imagine this is done after 5 types of Shodhana. Then a separate Upaya Shodhana is done, then the whole body is devoid of any impurity. Then what we have to do? As per text, it advised to undergo Yavana. Yava means, Yava is something like barley, and it is prepared separately, and the individual is given only Yavana. It may be Treham, Chaduraham or Shadaham. Yavanam is given, and if it is given for 3 days, 5 days or 7 days according to the Shuddhi, then the patient will get new fecal matter. So, the whole old fecal matter itself get cleared from the body and new fecal matter is created, the individual becomes totally new, then you can start Rasayana. So, this type of Shodhana is very, very mandatory for quality Kudi Praveshika Rasayana. Let us now discuss what are the different Rasayanas in practice. As already I told you, we can select single drugs, combinations or different types of regular using diets etc. can be practiced as Rasayana. And the most common thing is nothing other than Kshira and Ghruta. In our day to day lifestyle, if we add sufficient amount of Deshi ghee as well as Kshira to our daily routine, it itself is Rasayana. Consuming good quality water itself is Rasayana, Udaga Rasayana. Do you know there is a place in Pakistan occupied Kashmir which is called as Hunza district, where people live to 140 to 150 years of age. It is a mountainous terrain where people are very strong, robust and devoid of all diseases. They are able to bear child at the old age. It was explained that the only thing which is different from other part is that they get the most quality water. So, water itself is a wonderful Rasayana and many other things. So, you can adopt many things as Rasayana. As Ayurveda is explained, few things can be regularly consumed like Shalayu, Yavaghuduma, Koradosha Priyangava, Mudga, Masura Stuvera, Tikta Shagani Jangalam, etc. Many things, Vara, Patola, this many things are there which can be regularly consumed like Triphala or simply Amalaki or something regular usage of Mudga, anything which will be again giving Rasayana property. But as already I told you, in the fast lifestyle we are unable to do all these things. So, when you get a patient who is suffering from a disease which is not cured by the conventional palliative therapy or shamana or the plant Shodhana therapy, purificatory regimen, still if not responding, we need certain medicines. And such medicines are called Rasayana. Excellent are Bhalladaga, Pippali, Tuvaraga and many other things. I will tell you, Bhalladaga is a wonderful drug. It is a very toxic drug. If you consume Bhalladaga, there are chances of blisters, there are chances of rashes. But we properly process Bhalladaga, then given to many patients, and it becomes a boon for many musculoskeletal disorders, many metabolic disorders, many diseases of neurological origin. So, a patient already suffering from a degenerative neurological lesion or an incurable muscular dystrophy or a patient of conditions like myositis ossificans or any such diseases which normally not curable, probably Bhalladaga is a wonderful option. Bhalladaga as per text is explained to be is equal to Agni, Bhalladagani, Tikshnani, Pagini Agni Samanicha, Bhavatyamrita Kalpani. It is very equal to Agni. So, if the individual is not having Agni, imagine a patient of hypothyroidism, no appetite, no digestion, the whole body is always feeling cold and the patient is unable to tolerate cool surroundings, patient is not feeling appetite, always sleepy, not perspiring and the heart rate is low, gaining a lot of weight without eating anything, and in such a patient the whole Agni is dead. What we can do? We have to improve the status of Agni. Treat the patient with Bhalladaga. You can increase Bhalladaga in different methodology. Vardhamana Bhalladaga Prayogam is a wonderful approach in Ayurveda where the Bhalladaga is made into Kshirapaka and slowly the Bhalladaga, number of Bhalladaga increased day by day and slowly the patient is getting the cure from diseases. Bhalladaga is proved to be an excellent drug for many ailments. The second is Chitraga to improve Agni. Chitraga is a wonderful, I have seen many patients improved of Chitraga with many diseases. I had a patient of chronic inflammatory demyelinating polyneuropathy. He was totally bedridden because of this particular ailment. The patient was unable to move his single finger because of the disease. He was got treatment at a Vellore Medical College, and he was on cyclophosphamide and intravenous immunoglobulins and many other drugs including different types of steroids etc., and became virtually bankrupt because of treatment. Once this medicine is stopped, IV immunoglobulin stopped, then patient becomes totally paralyzed. We admitted the patient at Kottagal, we treated for nearly 8 months. It was the patient's willpower. I told you already, the Rasayana patient should need a willpower, and he has undergone the whole treatment for 8 total months, and now he can move totally free, he can ride bicycle, those who was totally bedridden for 8 months, for 3 years after the start of this chronic inflammatory demyelinating polyneuropathy. There are many such diseases. We have seen patients of severe psoriatic arthritis, recurring arthritis, undergone modern treatment, get a slight relief by one single course of therapy, again recur. In such patients we give Tuvaraga Rasayana. Tuvaraga is Hydnocarpus laurifolia. It is an oil. It produces severe vomiting as well as diarrhea, and this gives a lot of results. So, there are such drugs, single drugs, which can be practiced as Rasayana. And sometimes if you want a quality excellent intellect, memory, retention power, you need some Methi Rasayana. Methi Rasayana is a unique concept of Ayurveda, which is called as a wonderful boon to the functions of brain. 4 important Methi Rasayanas are explained in text. Mantuka Parnya Surasam Yathagni, Kshirena Yashti Madhugasya Churnam, Rasam Guduchya Sahamula Pushpa, Kalkam Prayunjida Cha Shankushpa, Medhyani Cha Etani Rasayanani, Medhya Visheshena Cha Shankushpi. It is having other indication like Ayu Pradhan Nyamaya Nashanani, Balagni, Varna Swaravardhanani. But naturally these are known to be Medhi Rasayana, Manduka Parni, Sandala Asiatica, and Yashti Madhu, Glyceraceae glabra, and Shankapushpi, Clitoria ternata or Convolvulus pluricalis, according to availability of that place. And such drugs, Guduji, Tinospora cordifolia, these are all wonderful Rasayana which gives a lot of result. We have seen many patients suffering from dementia, no answer in any system of medicine. If it is diagnosed in the early stage of life, we admit the patients, undergo the whole Panchakarma, and we give Shankapushpi Rasayana, which gives good purgation to the patient and gives a lot of relief from dementia and totally reverse the process. So, such Medhi Rasayanas there. If you have a skin issue, Khadira, Acacia catechu is a wonderful Rasayana. If you have issue with what is called speech or something like your voice is not clear, Yashtimadu is a wonderful Rasayana. So, there are many such Rasayana drugs explained in Ayurveda. So, probably when you hear Rasayana, in your mind you have Chavanaprasham in your mind, is it not? Chavanaprasha was a Rasayana formulated by Chavana Muni actually it is given to Chavana Muni by Ashwini Deva to improve his health from the old age. Nowadays it is marketed without its real sense. Chavanaprasha is a Rasayana which is called as Prasha because it is something like to be eaten like regular food. The amount of Chavanaprasha probably an individual can consume 150 or 200 gram of Chavanaprasha in a day as a whole meal itself. There is no meaning in giving 1 teaspoon of Chavanaprasha, or it cannot be termed as Rasayana. Rasayana of Chavanaprasha is a unique concept of Ayurveda after proper purification done. So, Rasayana, Chavanaprasha Rasayana, Brahma Rasayana, Vasishta Rasayana, and many things. And certain Rasayanas are not explained in the context of Rasayana. Something like Agastya Rasayana. It is a Rasayana explained in the context of Kasa, where this drug is used for many respiratory ailments. So, such formulations are also explained as Rasayana. and there are certain tips as Rasayana. For example, if you want to preserve the quality of your asti, you can regularly consume Krishna Tila, black sesame seed. Dine dine Krishna Tila pragunjam. Every day if you consume 1 prakunja of sesame seed, then you will get wonderful teeth forever. So, such many drugs are explained, and that if you go through the reference of text, it is explained that medyam gavamabi kimu manushana. Even if normal animal like cow also becomes intelligent by such Rasayana, then is there a matter for human being? So, there are such many approaches. Don't think that Ayurveda only explain medicines or herbs or some herbo minerals as Rasayana, like Shilajadu or other drugs. But Ayurveda also advocates lifestyle as Rasayana. This is called Achara Rasayana. This is called Achara Rasayana, in which your code and conduct of life should be having a discipline, and that discipline itself gives Rasayana property. So, I have explained to you that there are many herbs or herbo minerals which can be practiced as Rasayana, but Ayurveda does not say that only herbs or herbo minerals are useful for Rasayana. Certain lifestyles, certain code of conducts of life, that is also very important as far as Rasayana is concerned. So, in which we have to follow certain regimen in our life, we have to follow certain rules and regulations. This is called as Achara Rasayana. Ardra Sandanadaha, Tyagaha, Kaya Vak Chedasam Damaha. Many such things are very important to maintain the quality of living. If you are leading a stressful life with earning a lot and always behind worldly pressure, probably you will end up in a early finish of your life. So, if you are living peacefully with a lot of values in life, then you can live more. This is called as Achara Rasayana. So, the holistic concept of Ayurveda always give importance to, equal importance to the quality of mind, the quality of Atma, the soul, as well as the quality of the physical body to maintain longevity. Rasayana is a wonderful concept in Ayurveda. It is not something which is propagated through the advertisements. It is a very specific and properly planned procedure in Ayurveda, which you should know better and should practice in your life, that will cherish the Ayurvedic science as well as help many people of diseases to cure from their ailments. Thank you for a hearing. Now we have discussed the concept of Rasayana.